Great. This microphone's like chewing.
Let me record. Recording. Wait. Action. Yes. All right, we are live and recording.
Great. Okay, let's go ahead and get started. Welcome, everybody, to our October board meeting. We are at quorum today, so we'll go ahead and get started. We do not have anybody for privilege of the floor, so I will move directly into approval of the minutes. Board members, if you need it, you should have packets in front of you. There's a couple extra packets up there. We get a motion about the minutes. Okay, so I have a first from Ravinder to approve as written and a second from Ed. Any additional discussion on these? It's corrections. Okay, all in favor as written. All opposed? Were you in favor as written?
No, I'm
You're gonna
abstaining.
abstain, and we have an abstention from Sue. Okay. All right. Oops. Fancy new stuff, the fancy new layout. I'm a little, I got it.
Yeah, really for
Very, very nice. Okay, so let's go ahead and move on to the financial summary, which I think, is this for 2 months, Brenda?
Yes.
Yeah, that's what I thought. Okay.
The September is in there. It's labeled month 8 on the far right. I'm sorry, that is August. And the September one is labeled month 9. That's 75%.
It's up at the top over the table.
Right.
Okay.
I don't have a lot to add. Staff are in the midst of third quarter claims. They process both in October and November. You'll notice some of the salaries or the expenses are down a bit. I think some of that is really tied to staff vacancies. In addition, each month payroll, I'm starting to tell you when payroll is posted through. So the September one is payrolls through September 16th. So the last half of the month actually got paid in October. So it reflects in the October statement. It's on a cash paid basis. I don't have a lot to add.
Thank you. Any questions from board members on these? Okay, let's go ahead and move on to the medical director report.
Thank you. Good day and good afternoon. Nice to see everybody. So my report talked quite a bit about the status of preparation for the COVID pandemic and talking a bit about the future. To put it into context, we have about 1.148 million deaths from the COVID pandemic in our nation. When you add up all the deaths for all of the wars, from the Revolutionary War through the War on Terror, we come to 1.3 million deaths. 1.3 compared to 1.148, not too far different. So that has led me to be thinking recently about preparation for war, and strongly influenced by the book that I referenced in my written report to you, which I strongly recommend as good reading to summarize and encapsulate where we've been and where we need to go. And when we prepare for war as a nation and we fund our Defense Department and so on, we make sure that the tools that we need are there, and we make sure that the money that we might need to allocate is there to be quickly dispersed, rather than going through an appropriation and measures through Congress to take 2, 3, 4 months or longer. And I think that thinking of that war analogy helps you think why we were slow on many things when we entered this war on the pandemic, on the virus, and why it didn't work so very well. There are a lot of other factors. I'll give you that, confounding the situation. But a lot of it had to do with having supplies, supply lines, communications, data acquisition, data analysis, having your thumb on what's going on, and having systems that didn't necessarily rely on methodologies that we knew weren't going to be terribly reliable all the time. So 1.3 million deaths of all the wars, 1.148 from the pandemic. Isn't that justification for thinking of it as a war? And the pandemic and the next pandemic we deal with, the next virus to come along, we don't want to be as flat-footed as we were with this last one. I think in reading that, what I've been reading and thinking about it, what made our county stand out was that we were able to short circuit a lot of the national problems. We had a legislature that appropriated money, didn't rely on waiting for a grant to come through from someplace or another. We had a legislature that was willing to move workforce around to make things work. We had partners in the community that weren't hidebound by following some arcane procedural kinds of stuff. They just got in there and did it. We also had some public-private corporation things going on with, I'm thinking in terms of testing, mass production, people that pitched in and can-do attitude, et cetera. Even so, you know, our death rate for our county was still only about 40% of the national death rate in this pandemic, 40%, not 20%, not 10%, 40%. So there's room to do better. And I think in thinking and going forward and advocating with our political contact, our elected officials at all levels, having clarity and thinking about where are the issues and what should we be pushing for. I think that's where we should start going. So I recommend thinking about it in the context of a war. It's a war against a virus. It's a war that it's a virus that can insinuate itself in the length of an airplane ride from any part of the globe to our part. And it only takes days to weeks to a month or two to propagate itself within our borders. And unless we're prepared to deploy immediately in a pandemic, we're looking at many deaths. So that's sort of a sober message today, isn't it? But I think one that has come to a time where we need to talk about it. We have enough distance now on the pandemic to be able to think about it. We can still remember the bad days when we were all terribly fearful, and we still then have that gut motivation to take steps. So thank you.
Actually, so just so the board knows, this is on page 9 of the packet, the recommended book. And there's a link to it if you are interested in reading it. Oh, actually, maybe there's not a link to it. I think I might have Googled it. Sorry if I'm misspeaking. But I should just shift gears to another thing that was in your report that I was actually a little bit curious about was the oral health summary that you did, and I was a little bit interested in hearing about this study that you're about to do. And I mean, sort of where it came from, like, what's the goal with that? What are we using that information for? And then I thought it was great that one of our public health fellows is actually working on that.
Oh, Rachel and I in Sagarika met just a couple hours ago, actually, about the study. And it's a combination of a number of things, the origin of it. So one is a continued perception that we do have an oral health problem. It does have equity as a part of the problem, and that certain folks have trouble accessing dental health preventive care, and certain folks have trouble getting treatment when they do have carious teeth develop or abscess, a dental abscess develop. It's also the study and the interest in it comes about just somewhat propitiously from having Sagarika join us as a public health fellow, because she also has a degree in dentistry. And so she has knowledge in that field. And she completed a master's in public health at Cornell and has connections in the program. She knows faculty there. She knows other students. She's done some survey work before. And there are people interested at Cornell in helping facilitate such a study. So our goal is really very simply, where are we currently with people having, and particularly young people having dental health problems? What is the current status of their access to meaningful care? And what are the opportunities that we might have as a department to close some gaps? And Rachel, did you want to add anything to that?
No, I think that's a good summary, Dr. K. I will say Sagarika did an undergraduate degree in dentistry. She's from India, and so she studied over there, and she's planning after her fellowship completes here to go on for a dental degree here. So she's applying for dental schools to become a practicing dentist.
In India, the undergraduate degree allows you then to practice dentistry.
Yeah.
So
Obviously, standards are always different one nation to another.
Yeah, so I guess there's two things that I was also interested in this, not that I'm trying to give that person more work, but I was sort of interested in the intersection with the schools and
Yes.
use of that in the
School-based.
schools. Melissa is
Mhm.
also doing every other thing in the schools. We thought.
No, it's actually part of our, we actually had one of the new dentists come talk to the nurses, because it is one of the biggest things that
Big
we see that
kids
we
miss
have no
school.
place to refer kids.
Yeah.
And it's hard. Sometimes the dental van comes down from Finger Lakes and goes to the school parking lots, but it's huge need.
The Medicaid eligible population there's very reduced services for.
Very reduced.
Medicaid.
From what Dr. Ames said, is part of it is reimbursement from the state. So
Yes.
like
Terrible.
45-minute visit gets some ridiculous amount of money. So
Right,
there's already a shortage of dentists in the area too, but
right.
yes, I wrote.
So that's the other piece I wanted to talk about, which is in addition to the school, is it would be really interesting and helpful to understand as part of that, the shortage and also sort of the pathways, ways to close that gap or that shortage, if we could think about that a little bit.
Residency program.
Right, because, and I know Dr. DeLima's on Zoom, but I'm sort of thinking about the role of higher ed in the community and how we take that data and help with closing that gap, but also since the hospital is doing some work now around their learning center up at the mall, which I know is focused right now on other areas, but I don't know if there's, especially when we think about dental hygienists or other I don't even know what it takes to do some of these things. So anyway, it caught my eye, and I just thought that we have some board members that might be interested in different ways in this topic. So I think if we can also just think about not just about identifying what's the need, which I think is an important part of it, but what are the solutions and how as a community can we help contribute to those solutions? I would be interested in that. So.
We, meaning Sagarika and has been in touch with Carrie Burke of the Ithaca City School District, and Rachel, you were, I think, planning on buttonholing Melissa.
I know, I was supposed to do it and I dropped the
At
ball,
this
so I
meeting.
have you as the checkbox to connect you with the other schools, yeah.
Great, we want to connect the Trumansburg, the new
Dentist in
grad.
town, she might be helpful too.
What was that?
The new dentist in town is great. She came from
Yeah.
Bronx and she's not pediatric. She did a lot of pediatrics, but
Okay.
she's interested in public health.
Great, we're looking for partners for sure.
Any other questions from board members on the report? Okay. Frank.
Really, the only thing to add is to the report is the new report format. Want to thank Sam and Zoe and Karan and Ted and all of the folks that give input to the packet to help us kind of move this forward. It was came out of the conversation you all had several months ago. The goal here we're trying to achieve is for us to pull out the things that we think are most important for your attention, but still giving you everything if you choose to want to work through that. So the way it's designed is there are highlights at the beginning of each packet, which staff get to say, these are the things we think the board should be looking at this month. So yeah, it hasn't necessarily shortened the packet, but what we're hoping is it's more usable for you. It gives you some, a better tool to kind of understand and see what we think is important to draw your attention to. Where it's still a work in progress, so it will morph over the next few months as we kind of tweak this and get more experience under our belt. So we are open to any feedback or suggestions that you guys might have. We want the packet to be a tool that's useful for you.
So I loved it. And the things that were great for me was that it certainly helped me focus. I understood what was more important to the department. And I realized that as I was going through, I was like, cool, I actually am I'm able to absorb this and I'm focused on what I think was interesting. And then I also really liked the clickable links in there because it was really easy for me to sort of navigate around and get to the things that I wanted to look at. So I wanted to express appreciation to the staff for all the work that went into this, because at least for me, and I know I'm an N of one, is that it was much more usable for me.
It's great.
I love.
I agree. Yeah.
Great.
And I did click, like I was saying, when I went to the back page and looked at the chart for Dr. Claypack for the vaccination rates, I realized I didn't read as well as I should have, and I clicked back on and I reread your.
Thank you for the all work.
Sure. That's all that I have.
And I just have to say on this one, I want you to know that Jarrell is also at IC the next 2 days working with us on equitable research design. So in this part of the report, that caught my eye too. So. Okay, let's go ahead and move. I'm sorry, any questions for Frank on the director's report? Okay. Division for Community Health, Rachel.
Yes, nothing major to add, just that we've been busy with back to school ends, flu season, the new COVID vaccine rollout, all increased phone calls and busyness, especially for our immunization staff. I did report that we hired a new nurse. Unfortunately, she got a better offer and was with us for 4 weeks. So she actually ends her time with us next week. So I will be looking into that hiring process again. So there was the shining moment of time when I was fully staffed, and I will fondly remember those 4 weeks. Which is the first time it's happened since I've been director. So anyway, that's all I have.
Any other questions on this?
So the Legionella cluster, so did they ever come up with any hypotheses about what was going on with that? Was it just random, unrelated cases across the county?
We're still working on that with EH and the state and waiting for more results of the whole genome sequencing, which is really what ties together the clinical sputum samples with the environmental cooling tower samples. There may be multiple sources. We really haven't been able to pin down one that's caused a huge number. You know, there might be like cases here that, or a few cases here and there that were caused by different sources. So no, there really hasn't been one overarching source identified.
There are some cooling towers that we're working with though, right? But nothing for the entire cluster. So there's a number of cooling towers that are, we continue to work with. There, some seems to be fairly entrenched in some of the systems.
I was impressed. I hadn't considered this fact before, but when you have an infected cooling tower, it can infect other cooling towers. And just as a virus can propagate from one person to another, these systems can be cross-contaminated. So that complicates the whole story quite a bit.
So we're trying to have towers that are close together decontaminate at the same time, regardless of whether one was clean. Yeah.
Are there a lot of them, like in the,
A lot of
every,
towers.
yeah, like.
We've been
like,
working with, I think, in the neighborhood of like 14 towers
okay.
within kind of the city area.
As the temperature is cool, does that improve or decrease the risks associated with those cool?
Yeah, but we did another case. So it does decrease it, but doesn't eliminate it apparently. A number of the towers are shutting down, have shut down. Some of those towers only shut down, aren't just used for air conditioning. Some only shut down for a short period of time. And we have a couple that run year round. But a lot of the towers are shutting down now or have already. But they're not necessarily the only source.
Okay, moving on to Sam, health promotion.
I just wanted to announce that it is Lead Poisoning Prevention Week. And we have students from both Cornell and IC helping with distributing some door hangers around the county that just promote, lead awareness to families that we've done other years too. And then Liz just alerted us that it's also Bat Week leading right up to Halloween, which makes sense, but it's actually not about rabies. It's more about protecting bats for their contribution to the ecosystem. So yes, so we might have more press releases coming this week.
So the one thing I wanted to point out in this part of the report, which I think has been in previous reports, but it's just a lot easier to find right now, is the clickable link to the opioid data, which I know that Shauna has asked for in the past. So it is in there if anyone on the board is tracking that, or in the public who has been wanting to have that data available. Thank you. Children with special healthcare needs. Is there anything in addition to the packet?
There isn't, other than we are recruiting for our director. Brenda is filling in as interim in the interim. We've begun interviews, so we're hopeful that we'll find the candidate out of this candidate pool. But right now we're working to deal with the shortage. I should mention the legislature did include, at their behest, they reached out, Shauna and Dan Fine reached out to us about a proposal to try to address the shortage of therapists, and they have funded a 200,000-ish addition to the budget for us to add therapists to our staff. So we will be looking to employ 2 speech therapists, an OT, PT, a school, a special ed teacher, and then they're gonna share a social worker with the clinic downtown. So they funded 4.2 FTEs. That 200,000 is the county's additional share above what the rates would generate for the services that we expect those physicians to provide. So that was a big addition. I'm not 100% sure if it's going to close the gap. We still have to figure out, where we get these folks from. And whether we're just going to pull them from existing providers and not really address capacity. And so there's just a lot of ifs. The thing that you all should be aware of and that we will likely be coming to you about for some advocacy with the state is there's a structural problem with the rate schedule. It is not enough for rural counties to be able to recruit and retain providers in the community. The state contracts with these providers, so we don't have direct access to them anymore. So we're beholden to the state to get people contracted, and there's just not enough. And our wait lists continue to grow and grow. And it's just untenable for the kids that need these services. But the governor in her last budget did not even include an 11% rate increase, which quite honestly was minuscule compared to what the need is, but that was not even included, and that's problematic. So there's a lot of reasons behind that. Many upstate counties are opposed to a rate increase because they don't want to pay more. So we're kind of in this conundrum with we've got that problem. The city and the metropolitan area, they can go in an apartment building and spend one day in that apartment building and see numerous kids. So the rate schedule is feasible for them. It doesn't work that way for us in a rural county. So there's a lot of issues. This is an effort to try to help support that issue. We're going to go slow and strategically and not rush right into it. So we don't want to create more problems with it, but I did want you all to be aware that the legislature has included that in their budget. So once the budget's finalized, we'll begin the process of starting recruitment.
Loan repayments for specialties like speech therapy, OT and PT, like they do for medicine in shortage areas? Like, is that something that?
I don't know. I mean, you generally, for most of those, you have to be attached to an organization that's certified and recognized as serving folks like that. I don't know. They're contracted employees with the state right now. They're not employees of the state. So I'm not aware of any. I can certainly ask, but that has not been something that I've heard as an option for them.
Christina said only with military replacement, she's seen it, not for.
I mean, I'll look and I'll check because. And when did you say the 4.2 FTEs would start?
January 1.
And that's for how long?
They give us 3 years.
And do you have the position descriptions written for those yet?
Brendan's
Working
working
on. Would you send us? And you have that, please.
The only thing I'll add, they did make a note about the core evaluation team. Last week, Capri let me know they are now having to book core evaluations out in January. So there's just not even appointments to do that stuff.
And with these positions, we would actually have enough to create a core evaluation team. So they would form a core evaluation team. So there'd be an additional one in the county.
And is this on like a fast track hiring process, or it's subject to sort of the
Same process. Generally, once the legislature votes in November, they allow us to begin the process with an anticipated hire date of January 1 at the earliest. So we'll be looking, relatively quickly.
Okay.
I think we have upwards of 58 kids waiting for speech therapy. So it's an acute issue.
Frankie, the issue is not just that we're not paying enough, is it also that there's just not a supply of people to do the work?
I think there's a little bit of that, but we have seen people leave early intervention for either the pre-K program or to go serve other therapy needs.
Okay.
Because the reimbursement rates are better, or there's the way the programs are built, they can see more people in a day, or the people are coming to them versus them having to travel. And so it's both the function and the rate schedule.
So these services are usually provided by the health department here on site?
No, they're in the.
Oh, in the home. Okay.
And this will be our first attempt in early intervention of hiring the therapy staff. We have traditionally just been the service coordinators.
Mhm.
So this is a brand new thing for us that we've never done. We're trying everything.
Okay, any other questions? Let's go ahead and move on to environmental health. Liz?
So we did end up getting the civil service test results from the test that was held, I think, in June. And so we were able to fill our senior environmental health specialist vacancy, our managing position, and we'll be promoting Renee Borgella to that position as of October 30th. We also are going to be backfilling the vacancy he creates with an environmental health specialist, Cameron Calburn, who will also be starting October 30th, and EH will be fully staffed, Rachel. For the first time in quite a while.
Enjoy it.
So yes, I'm really looking forward to it. The only other thing I'll just kind of mention, and then I'll get back to kind of putting in EH highlights, which I have not been doing while we've been down staff. We did have a meeting with Professor Alexandra Dufresne. She's a public policy professor at Cornell University with Shauna and Dan Klein and Frank and Skip Parr and I and Holly Mosher regarding the vaping issue in Tompkins County. And she and her students were quite interested. And so they're going to be looking into something kind of as a class project was the sense I got. So that I'm looking forward to seeing what they come up with this broken program we have. And the only other thing I'll mention is that we use the Excella permit management software to issue all of our permits, and they have informed us that it's currently what's called a hosted system, meaning ITS. Everything's on our servers. We do all modifications and updates ourselves, and they're ending that option and in 2025. So this could be a really big deal for us, whether we can stay with Excella and move to a hosted environment, not self-hosted, I misspoke, or whether we're going to have to be looking for a new software. So it's another project for us. That's all I have.
Okay, any questions on that? Okay, so let's go ahead and move on then to our enforcement actions. That's I think good. Okay, enforcement actions. First one up is the Cougar Nature Center violation that is related to water and summer camp. So if we could have a motion to approve this written, a first from Samara and a second from Sue. So Liz, is there anything additional you want to add to this?
So this was recently brought to you. I can't remember which exactly, whether it was August. It came to you fairly recently because of the problems have been having since June of 2022 with their water system. And they did make an effort to have some work done, and it just fell apart in several ways. So we are granting an extension until December 31st. And we've verbally given them some other options for people to contact, and we'll be providing that in writing and hoping something actually comes together for them this time.
Questions? Okay, all in favor is written. Mentions. Okay, Cinnamon Shop and Deli. This was a cold holding violation. And also prepared foods violation in terms of related to cross-contamination. So if we could get a nomination from the board or a motion from the board to approve this But we have a first, Ed. A second from our vendor. Is any additional comments on this?
The penalty is proposed at $200.
Board members. Okay, all in favor, it's written. That is unanimous. Next one is Old Mexico. Hold on 1 second. Let me just put my previous here. So again, temperature holding violations. As well as some change of dates in here. So a motion to approve is written. First from Melissa, second from Samara, Liz.
This is more of a refrigerated equipment storage issue than a cold or hot holding
Sorry.
situation. This is violation of Board of Health orders. We have been having recurring issues with Old Mexico. There's an added requirement with the current enforcement to submit a plan to try to address come up with a management plan or something for their equipment that they have not been able to get into operation and keep in operation. And if they are unable to, then we'll be considering either not reissuing their permit or going to short-term permits or something. Proposed penalty is $1,600.
Okay, and Liz, my one question on this one was that the payment of the violation was by December and then the plan though was by November, and that's correct. And that's what we wanted.
That is correct. We always, when we have we always have the penalty due
After.
right. So almost 2 months after Board of Health, but they've had this resolution before them since before, because it was previously on the September agenda. So we did not see any need to change the original deadline, or we changed it to November, but they don't need that additional time.
Any questions from other board members? Okay, all in favor then as written. That is unanimous. So let's go ahead to College Town Bagels. This is about temperature and cold and hot, I believe. Okay, so motion to approve is written. First from Sue, second from Ed. Does any additional?
Proposed penalty is $400.
Straightforward. Any questions or comments from board members? Okay, all in favor? Oh, sorry, go ahead.
Go ahead. Well, because it said in here somewhere that part of the issue is transportation from wherever they make the stuff, Trip Hammer.
We're transporting stuff to.
And so it wasn't holding temperature. I mean, do we want them to come up with a better system, or is that just on them to figure it out?
I was thinking that they were, so we can work with them on that, but normally that is something that they should be able to do. That shouldn't have, like they're either not taking the temperatures, they're wrong at the other end or something, if they're not able to do that process.
Okay. So that's just on them to figure out how to
So,
solve.
I mean, we'll work with them and we provide advice, but yes, it's not,
Okay.
transportation itself isn't an issue.
Oh, I see.
Any other questions? All in favor? That's unanimous. Okay. And then now we have a few administrative actions. We already did number 1, which is discussion and review of the Board of Health packet. Is there anything more on that? Okay. What are these? Yes.
So this is the time of year where we have to talk about membership, and this year Christina's term is ending at the end of this calendar year. We would normally form a nominating committee if she was not eligible for reappointment, but she is. We've consulted with her, and with minimal arm twisting, she had
Did I answer that email?
choice in the matter. She has said she's interested in being reappointed, so the board has a couple of options. You could form a nominating committee to consider that. And then come back next month and make a motion, or if you're comfortable doing a reappointment now, somebody could make a motion to recommend reappointments to the legislature. You can get that done.
Put your head down on this.
Cover your ears.
So Melissa, you should probably.
I would like to make a motion to reappoint her.
Well, no, you should be the chair
Oh,
and
okay.
ask if somebody would like to make a motion.
Would someone like to make a motion to reappoint her?
I do.
You need a second,
We do need a
Ravinder?
second.
Do you third?
Any discussion?
Does anyone want Christina to leave the room for discussion?
No,
No, everybody.
All in favor?
yeah, thank you, Christina. You've done an amazing job.
Can we make a motion to have her continue as president too?
Is
that on-
gonna do that, because we're gonna have to do that in a month or two anyway, so it's up to you guys. So you can double back, Christina.
Okay, thank you. And so unless there's any other new business. And I think we've covered everything on our agenda and we can adjourn. All right, so we'll see so is November a combined meeting? Like,
December.
So it's actually December, right? So everybody knows you don't need to get.
You're saying
in December. Are you two listening? Because you're gonna tell. Or no one's.
I know.
Yeah.
I know there's no November meeting.
December 5th.
December
December 5th.
December 5th is our next meeting, so we have no meeting in November, so December will be our end of the year meeting. Yeah. Okay. Have a great holiday for those of you who celebrate Thanksgiving or other things that happen in the month of November, and we'll see everybody in December.
Great.
Thanks.
I need to talk to Jeremy about kind of tonight's meetings for the financial report.
You know, one more.
Yeah, every time.
The meeting seems.
Now Riley's gonna have.
Very efficient.
All right.
That's why I
Yeah,
voted
you guys
for it.
are- yeah, all right.